2, 1. Good evening. Thank you all so much for joining the Minority Caucus. Today is Monday, October 12th. Meeting started at 6 o'clock, and I think we are starting at 6:09. So thank you all so much for taking time from your schedule so we can take care of some city business. We have a special guest with Councilmember Brett Withers, who wanted to address the caucus this evening. So please welcome him as he presents his platform.
Thank you so much, Chair Sharon Hurt, and to the committee members who've joined. Thank you for your service to our city and for allowing me to join you just briefly today. What I wanted to bring before the Minority Caucus Committee is in years past, I have introduced a resolution before the Metro Council that recognizes Transgender Day of Remembrance, which is November 20th of every year. And so for the past couple of years, I've authored that, and I do have a draft of that that we sometimes modify. But as many of us know, the violence against transgender persons or persons who might have a different gender expression is violent, often results in death, unfortunately, and also, unfortunately, disproportionately affects persons of color. And so since the Minority Caucus is meeting today, I wanted to let you know that I'm working on that resolution again and wanted to seek your input. You don't have to provide that tonight, but I just wanted to seek your input so that when we do get that legislation before the Metro Council, it needs to be to the council office by November the 6th. But just wanted to make sure that you've had a chance to review it in advance and to see if you as individuals or as a caucus would feel comfortable co-sponsoring it this year, and also to see if you had any specific language that you might want to include or anything you'd want to change or want to include. As I mentioned, the violence disproportionately affects persons of color. And so I want to be sure that communities of color are invited to help us all craft that language as appropriately as possible. If any members are interested in, you can actually look at the one from last year. It would be Resolution RS 2019-87 is last year's. Like I said, we sort of have a template. There are organizations that track those unfortunate deaths. And so I would typically update that number with those sources. But again, just wanted to put it out there and see if any of you in the next couple of weeks would want to take a look at it and maybe make suggestions, even take it out to your own community members or constituents to sort of look at that draft and see if you have anything that you would want to change or add this year. And that really is all of my business before this committee, but on behalf of the LGBTQ caucus, we wanted to always seek opportunities to collaborate and ally ourselves with the Minority Caucus. And so appreciate your time in granting me this audience tonight.
Thank you, Councilmember Withers. We certainly appreciate you and the LGBT caucus, as you all have shown strong support for the Minority Caucus. And personally, I do consider the transgender community to be a minority, and I would encourage members of the Minority Caucus to join me to sign on to the legislation as I did in previous years. And I do think that it is a senseless act of hate that we've had transgenders to be subjected to such violence and hate crimes as we've seen, and would hope and pray that it will stop. But you can count on me. I will definitely let Hannah and Danielle know that I am going to serve as a co-sponsor, and we as a caucus, if you or anyone would like to make a motion, we can entertain a motion or any discussions in regards to Councilman Withers' legislation. Are there any questions? I don't see any. Okay, Councilmember Sepulveda.
Yes. Thank you, and thank you, Councilman Withers, for bringing this to the caucus. I really appreciate you looking at the big picture and thinking, yes, let's include the minority caucus in this. I haven't looked at your resolution yet. I just wanted to ask and see if you would be including statistics in regards to minority transgender people in your resolution.
Thank you for that. Typically what I try to include whatever information I actually have. So that, pardon me, information can be a little bit challenging to come up with sometimes. But for instance, I'll read from the one of the recitals from last year's resolution, which is available on the website, and I'll see if there's an update. But one of the recitals that was included in last year's says that whereas fatal violence disproportionately affects transgender women of color, who comprise 80% of all anti-transgender homicides. And that, I think, was the most specific statistic that I had at that time, and I'll see if it's been updated. But if any community members have, again, specific information that you're able to find in your sources, I'd be more than happy to include that, because like I say, this violence is so disproportionate against persons of color, and also often, unfortunately, goes unreported. So it can be a little bit difficult to come up with a definite number. But if any members of the caucus have specific information or even just language that you would like to include, I definitely welcome that. And we just need folks to send that over to Hannah in the council office so that we can be sure to look at that and include that.
Great, thank you so much. I do think that if we can find information to include that, I think it paints a picture of what the situation actually is in that community. So I appreciate that. Thank you, Councilman.
Councilwoman Sepulveda, are you making a motion?
Sorry, it looks like Councilwoman Vercher has a question, so I don't want to interrupt questions.
Right, but I wanted to go ahead and get the motion in a second, and then we move to the discussion.
Yes, Madam Chair. Then I make a motion that the Minority Caucus supports and signs on to Councilmember Withers' resolution.
Thank you very much. Is there a second?
Councilwoman Gamble seconds.
Thank you very much. In discussion, Councilwoman Vercher. Councilwoman Vercher, have a question? Councilwoman Vercher, did you have a question or a comment?
Madam Chair, I don't.
Okay, great. Thank you very much. Any other questions or comments in regards to the motion that's on the floor? There being no questions or comments, all in favor say aye.
Aye. Do we have to take a head count vote because of the electronic?
We can, and I will happily call each name. So let's start with you, Councilmember Gamble, since you're on the call.
Aye.
Councilmember Sepulveda?
Aye.
Councilmember Taylor?
Aye.
Councilmember Vercher?
Aye.
Councilmember Toombs?
Aye.
Councilmember Suara?
Aye.
Councilmember Lee?
Aye.
Councilmember Porterfield?
Aye. Aye.
And I, Councilmember Hurt. Thank you very much. Unanimously. Did I leave anyone out?
Yes, this is
Councilmember Toombs?
Styles.
Styles, I'm sorry, I didn't see you listed. Councilmember
I had
Styles?
I'm a yes.
Okay, thank you. Did I miss Councilmember Toombs?
Aye.
Thank you. Thank you all so much. It's unanimous. Councilmember Withers, thank you again for your presentation. If you you can stay on the call, or you can feel free to tend to other business that I'm sure you have.
I have so many constituent calls backed up, unfortunately. So I appreciate the support and wish you all a great meeting and great rest of your evening. Thank you so much.
Thank you. Thank you so much. So we also have Black Lives Matter's mural on the, I'm sorry, Councilmember Porterfield. Did you want to have a comment?
Thank you so much, Madam Chair. I'm sorry, I was having a hard time unmuting. That was before the vote. I just wanted to speak in support of it and thank Councilman Withers for including us in what he's doing. So that was it. Thank you.
Oh, okay. Thank you. I know there are other numbers on the call that I don't recognize. And I know that someone from Black Lives Matter mural had requested to speak and give an update. I know that there is an event that's been slated for this coming up Saturday, October the 17th. Grace, are you on the call? If so, please feel free to jump in.
Yeah, Grace is not here.
Okay, well, I don't have any other person, I don't think, who is interested in making a comment in regards to Black Lives Matter mural. I do want to share an email that I received just moments ago, and from Stephen Jones, who is a constituent in Bellevue. And his letter basically says that Metro Nashville government has overstepped its boundaries by allowing a Black Lives Matter mural to be painted on city-owned property. What gives Metro officials the right to choose which political associations to support and advertise for free? Metro is funding this political statement with taxpayer money by using Public Works and MNPD, and of course, city property. By allowing this, Nashville will be associated with the likes of Portland, Chicago, New York, Baltimore, San Francisco, and Washington, D.C. All of the above mentioned cities are in chaos from protest and vandalism. When Metro gives the okay for this political mural, it opens the door for other political groups to expect the same privileges. Blue Lives Matter would be a prime group to expect the same treatment. There are plenty of Nashvillians that still support law enforcement. It is wrong that our elected officials are allowing this to happen. They are pandering to votes and not representing the city as a whole. You would think the Metro Council would speak up for the citizens of Nashville. So I responded to him and told him that I know that he and I probably would not share the same perspective when it comes to many things, and this just happens to be one of those. And I would acknowledge his sentiments and share them whenever I was in various arenas where this matter may be discussed. I also mentioned, however, that there are other symbolic statues and highways and buildings that have done the same thing that this mural expects to do and representing the Black Lives Matter movement. But I would welcome any comments if anyone would like to share, and I will be glad to respond those comments to Mr. Jones as I presented it to this body. If there are any comments in regards to it, I can share with you. There is the event. Okay, so Grace is just texted and said I'm asking, please call in. I can share, however, the event activities that are scheduled for the 17th. It's an opening ceremony that, oh my God. Give me 1 second.
Madam Chair.
Yes.
While you're looking for this is Councilmember.
I just got I was calling up the flyer, and there's the opening ceremony at 12, and the music and street mural painting begins at 1, and then there's mural paint brush participation, community opening, food trucks, candlelight vigil, and closing ceremonies at 6. So it looks like it's going to be from 12 to 6. It says that masks are encouraged, but I would definitely say that masks are required and not necessarily encouraged. I know we're outside, but we want to make sure that we always provide a safe environment for anyone who plans to attend. Grace, if you are on, but she hasn't gotten on yet. She's also trying to get the link. So hopefully she'll be able to join us. Are there any questions or comments right now in regards to the... Yes.
I guess Miss the individual that sent you the email to send me one. I have not had the opportunity to respond. But one of the things in the email that was addressed was Metro funding this project. My understanding from the article that I read in the paper was that it's a private group and there were donations received from the project. Is that not correct?
That is correct. However, he was speaking of the presence of Metropolitan.
I just want to
I think he was
to clarify that.
Well, the thing
as part of the response to the email, the article that I read said it was privately funded from private donations.
It is correct that
there's a storm, so I may be going in and out. So
yes, you are going.
How much of what?
You are going in and out, and yes, thank you, Councilman Maswara. It is, there have been donations, and donations are continuously flowing in for the project. However, I think that he was speaking on the fact that it's going to be put on our streets, which is paid for with taxpayers' money. When I went back and reread the email, that's what I thought he was speaking of in terms of the use of Metro police officers that may be in attendance to make sure that the street is shut off, the use of public works, because they have to, provide the permit for closure of the street, and the street itself is a metro street. So I thought he was speaking more on those foundational costs more so than the fact that they would be paying for the paint and the actual labor used in order to create the mural. Are there any other questions in regards to the mural? I'm still waiting for the representative, Grace, to get on the call. Any other questions or comments?
Yes, it's Councilwoman Gamble. I have a question. I'm sorry. I should have put my hand up. I see some hands now.
Okay.
I guess I was hoping to get more information about what the plan is for the mural, and hopefully Ms. Grace will be able to join and tell us a little bit more. But is it that the caucus will take a position on whether we support the mural or not? Is that the objective?
Well, I think that may be what she wants. The thing that concerns me is that I've not heard from the mayor's office that they are actually in support of the project. And that's been one of the underlying things that I've had concerns with for the duration of the discussion, is having the support of the mayor's office. So, I mean, I know that those individuals involved are anxious, and they've been working for a couple of months to get this done. And I know that they've gotten traction, and they've been progressive in getting the support from the at-large community. And they want to move forward, and I'm sure they want the Minority Caucus's support in moving forward. But the pause that I have is the fact that we've not gotten support or approval from the mayor's office. And that's the only thing that concerns me. And that's why it's important for the body to speak on this.
Thank you.
You're welcome. Councilmember Toombs?
Councilwoman Gamble covered a lot of my questions. I was just wanting to know what was the ask from to the Minority Caucus in terms of moving forward, and whether or not there was a timeline, like when is this going to happen? I know Councilwoman Suara mentioned that she thought that it was all private funding. I think there has been some public support from the administration. I don't quote me on that, but I could have sworn that there was some public support from the administration for the mural. I hate to respond to that email, but we do have people that watch these calls, and Black Lives Matter is not a political statement. It's more of a human rights issue. And again, I hate to respond to that email because I feel like I'm having to justify my Blackness, and that I am also a resident and taxpayer of Davidson County. But I did want to put that out there in the airwaves, the interwebs, that Black Lives Matter is not a political statement. It's not anti-police. It's more of a human rights issue, that Black people deserve just treatment in this country. But other than that, like I said, Councilwoman Gamble covered my thoughts, and just wanting to see what the next steps are and what we're supposed to be doing.
Thank you, and I think you're exactly right. And I tried to address that softly in my response, because I did not want to, have any back and forth with that. The support that I do know that the Black Lives Matter may have gotten has been from the Arts Commission, but I've talked to the mayor's office as late as 4:00 this afternoon, and have not gotten that unequivocal, defined yes or no. And it is being paid for through private donations, and that's in terms of the paying for the artist. I think, however, as I stated earlier, that the gentleman was speaking about the fact that it's going to be use of our Public Works Department and our streets that is where his concern is. So Grace has joined us now, and I'd gladly turn the floor over to her. You're on mute. Unmute.
Thank you. Thank you very much for allowing me to be here. I'm always appreciative of speaking with any of you. Could it be possible if you could field questions that I could answer? And I heard that a little bit about the funding. I don't know what else went on before I got on. To address real quick regarding the city's participation and funding of it, no, that's not occurring. In order to be able to be allowed to do an art project like that on the street, we needed to have a street closure. And so that had to, of course, go through the permit process through Public Works. And so for the rest of it, the artists, the paint, the equipment are being paid for either through private or funding or grants that we applied for. And so that's where it is right now. Any other things that we might need for street signs or signage that we need to put up, we're doing private fundraising for that. And so that's where the support is coming in. But there are no tax dollars being involved. In fact, we have to pay for the traffic control plan through a private security company and all of those type things.
Thank you. And the other question was, what is the ask to the Minority Caucus? Is it just for our support, or what is it that you all were expecting from the caucus?
Thank you. So when we first addressed you a couple of months ago, I would imagine, I enjoyed the support then. Of course, we were just starting out through the permit request process and probably still looking at considering the Thrive grant application process with the Arts Commission that's available for arts projects around the city. So at that point, it was a group of people who may not have been typically involved in projects like that around the city, okay, as a group per se. And so when we approached you, it was for your blessing, you know, because you are the Minority Caucus. And this is, and I loved what I believe Councilperson Toombs was saying about the statement about Black Lives Matter. If we don't matter to ourselves, who will? And that's the purpose of this. Prior to the last 5 years, murders and killings of Black people, unarmed Black people, and certainly all the things that's come about of harm to our community, generation after generation, we get tireder and tireder. And so we're using whatever peaceful means we can to make a statement and to inspire the spirit by doing what we can to let people know that this reality can be discussed now. And part of that is through the use of art or any other means that peacefully can engage so that we can mitigate and lessen and stop all these killings and the harm that's going on to the Black community. So this mural is one of those efforts, as I stated before. It's an effort to elevate, to bring pride to the Black community, because what we're doing is reclaiming the little bit of space Black people get to have in this city, apart from just living in our houses. Like I said, when the Black Lives Matter mural points toward downtown, it will show a number of buildings, tall buildings, that are not owned by any Black person. Am I right? So there's some issues, and that you have shared with me also, Councilwoman Hurt, that I've also heard before in other council proceedings and commissions, that that we haven't asked for. And so we're using this as an opportunity to further that discussion in as powerful way as art can be used for that.
Thank you. And to that point, I would like to share a couple of examples that I've heard that I really, really love, just for the purpose of sharing what Black Lives Matters mean. And being that we in the month of October, October is known for Breast Cancer Month. And everyone celebrates, acknowledges, recognizes October as Breast Cancer Month. It doesn't mean that lung cancer doesn't matter, or pancreatic cancer doesn't matter, or any other cancer doesn't matter. It's just the month of October is for breast cancer. And this parallel goes to Black Lives Matter. It's not that other lives don't matter, but right now, this Black Lives Matter is about, this Black Lives Matters movement is about Black lives. And that leads me to my second illustration that I think is really, really. And I heard Reverend Dr. Faison make this comparison, and he said that you on a you have several homes on the street, several houses, and one house may be White Lives Matter house, and the Latino Lives Matter house, and the Asian Lives Matter house, and the Black Lives Matter house. And the Black Lives Matter house is on fire. And when the fire truck comes to put the fire out at the house that's on fire, which is the Black Lives Matters house, not the other houses that are on the street. They are there and they are recognized, and they do have their homes there on the street. But the house that's on fire is the Black Lives Matters house. And I think that illustrates what this movement is about. And we're just trying to put it fire and let people know that they do matter. And we, again, I am like Councilmember Toombs, don't feel like I should be put in a position of having to defend my Blackness. But I do think that it was worthy of some discussion for us to have with you and for the Minority Caucus to make a determination on which way we're going to go. The thing that I spoke of, and you may not have heard me, the only thing that gives me pause, as you know, Grace, is that we've not had that approval from the mayor's office, which I think we should. They should have taken some stand, although I do know that Public Works and the Arts Commission and all of them are part of Metro. And I think that once it goes to those departments and they approve it, it may be acceptable. But I would like to see the mayor or someone from his office representing him state clearly their support of this event. Are there any? You're welcome. Are there any other comments or questions for Grace?
I have a question, Madam Chair.
Yes.
Grace mentioned about the permits for public work. Have the permits already been pulled, and have the permits been approved?
It's been pulled. It's in process. We only have one more step to go, which they'll be getting today or tomorrow. I received a written message from them that there was only that one step that needs to go. We're working with the security company who will be providing that document, a stamped document, back to them, and then they said that they will issue the permit.
Okay, thank you.
And it's in writing.
Okay, and Grace, I do know, being that I've had to pull a number of street closure permits, that they also want insurance in order to have you all gotten that taken care of?
Yes.
Okay, great.
We tried to cross all T's and dot every I, and we've had, as you know, already know, many requests from Public Works, assurances, and et cetera. Also, worked with the vital people in the mayor's office, who's also given us wonderful assurances and all the way up to today about the support. Now, yes, it would be great for a proclamation from the mayor. That'd be, and let's talk about proclamations. But you know what? We're putting down this as citizens and our right to do so, something also unique to the city. But then, like I said, we're reclaiming what little space we're able to grab ourselves in the right way in this city. I would love to see that mural disappear when we get some of those tall buildings and large companies coming in from our Black entrepreneurs who are able to get the appropriate financial wherewithal to do such. But until then, we have much work to do in my mind.
Thank you. Thank you so much. Any other comments or questions for Grace?
Yes, Madam Chair, it's Councilwoman Gamble. I have a question. Grace, thank you so much for coming and talking about what you all have done to move this project forward. I apologize if I missed it, but where can you tell us exactly the location that you have for the mural? And also a little bit, Madam Chair mentioned during the beginning of the meeting about an event that you have this weekend. And if you could talk a little bit about that, what your goal is with that event as well.
Thank you. So the event we're having is just the painting of the mural, and that will occur on that wide street of Woodland Street. The street closure will be at Interstate Drive and all the way to North First Street. Okay. The other closure in between will be at 2nd Street, where the juvenile court ends, so that just that one swath of street is closed so that the mural can be worked on. The artist will be working all day on it, and we have a set of volunteers who will be assisting them. A couple of churches are making sure that the artists are fed and given service during that day so that they can do their work. And we have to have a large number of volunteers because it is a long, wide street. And so we have to protect the integrity of that artwork as it's being performed. The event that you mentioned, we know that people are going to come and visit while they're working. And certainly when it's done, we do anticipate, hopefully, that all the painting will be done by 2 or 3 o'clock. And then, of course, it's a public street. People get to come and see it. We might have a little dais and microphones for people to give talks, because we're allowing, and we're not so much allowing. This is a public event, and this is for the people. So there's people who want to help out with providing a brushstroke, and so that's being planned so that we can manage it appropriately that day. I think we can get at least 45 people into that program to apply a brushstroke, because it is an accomplishment, and it's an uplifting way to help people re-energize themselves. So that's the location, as you said. And for the event portion, people, of course, this is just like any other city. Folks are going to come out, and so we're just trying to figure out how to manage that. There are other large events happening adjacent to us, and now people are becoming more aware of the mural. So that means we, knowing human nature, we know they're going to come to us. And so we have to manage that crowd. Hopefully, we'll try to hold them off the numbers of visitors until the paint is dried and everyone is situated and protecting of the mural so that it can be completely dry for visits, until traffic can resume the next day or the day after.
Thank you.
Madam Chair, I have another question.
Thank you, Council. Yes.
Grace, could you share with us who is responsible for the upkeep after the mural has been painted, when it needs to be touched up, or, if there's any, hopefully there won't be, but, if anyone vandalizes the mural, things of that nature, will the group come back out and touch that up as time permits? I mean, as time goes on and it succumbs to weather damage and things of that nature, the group going to be responsible going forward?
Right. So what we built into the budget and timeline was an opportunity for that to happen. We'll have to, investigate. The budget is built into that to occur either at the happening or every 4 months. So whichever is earliest or longer, we're still working those details out. So that is being planned for. As to who it is, we still have to negotiate that, okay? Right now, there will be a protective sealant put on it so that if tar or other paints are thrown on it, then it will be easily cleaned off instead of moving into the paint itself. And if I can just share a little bit, I went to Indianapolis, and that they have a mural. There's this, every letter is is an artistic piece. And so immediately within days, someone came through with buckets of white paint and splattered it across their mural. And it's so interesting. If you were to go there and look at it yourself, and there might be pictures of it available that you can look at. When you look at that, I was there in person to look at it, and I said, that rather added to the narrative of Black Lives Matter making itself, or our lives making itself very visible in this world. We walk down the street, or we walk into a bank, or we walk into a grocery store, and for most of us, we're invisible. We'll stand into a line, and people or you already know this, people will walk in front of you like you're not even there. We put a Black Lives Matter mural out on the street. It's not invisible. You wonder, why did this thing occur uniquely in this year? And I think the DC mayor, had a divine inspiration, because it's there. We're, as Black people, we may be invisible in this land, but that mural is not, which is the resentfulness of many people. So when they threw that white paint splattered across this artwork in Indianapolis, it did not cover all of the art, but it was, like I said, a narrative statement of the attempts of destroying Black lives. And so it's still there, because I think that other people who saw it said, that is the story. But we do have a plan to remove any type of defacement that comes down. So that is in the planning stages as well.
Thank you so much. Any other questions or comments? Is there a formal motion? Do we want to make a formal motion to support this, or do you think this is something that should be done on an individual basis?
I would like for it to be done, Madam Chair, as a caucus. And if that is not what we want, then I would like some conversation around that. But I think we should stick together to show our unity around it as a caucus.
So is that a motion that you're supplying, Councilmember Lee?
Yes, ma'am.
May I get a second?
It's Jennifer Gamble.
Councilman Taylor, second.
Thank you. It's been properly moved and seconded. Are there any other comments or questions that need to be discussed at this time?
Yes, it's Councilwoman Gamble. I have a question. So is the motion that we are going to support, and how are we doing a resolution or something to show that, or we're just expressing support?
I think that we can probably at some point do a resolution if that's what the caucus desire. But I also think that we can make a statement and just send out a press release indicating that the Minority Caucus actually goes on record supporting the effort of placing a Black Lives mural on Woodland Street.
That's a great idea. I love that.
And that's what the intent of my motion was, because I thought I heard the question about were we doing it as a group or individually. So thank you, Madam Chair. That was the intent of my motion.
Yes, you did hear. I did make that statement, Councilmember Lee. So thank you very much. It has been properly moved and seconded that we do submit a statement in support of Black Lives Matters. I'd like to take a roll call vote at this point. Councilmember Suara?
Hi.
Councilmember Toombs?
Aye.
Councilmember Gamble?
Aye.
Councilmember Vercher? Councilmember Vercher? Councilmember Porterfield?
Aye.
Councilmember Sepulveda?
Aye.
Councilmember Stiles?
Aye.
Councilmember Lee?
Aye.
Councilmember Taylor?
Yes.
And Councilmember Hurt is a yes. So unanimously, we have voted to submit a statement in support. We can draft a narrative, and I will make sure that it's sent out to the group before it goes forward. So thank you very much. Ms. Grayson, if you would like to, you can stay on the call. We've got one more subject matter to discuss, so you can feel free to continue the great work that you're doing. Thank you so much for joining us today.
Thank you all. This is for us all, and I'm so grateful.
Thank you. So the last thing that we had on the agenda was Bordeaux Hospital. As you all know, that there have been talks for several months in regards to Signature, who is the managing administrator of the health services being provided at Bordeaux Hospital now. And their contract expires January 31st, 2021. And there has been talk of them closing and winding down, and there is not a plan in place that we are aware of that will move forward with this. Councilmember Taylor, I know, is seeking to have a meeting. So I wanted him at this time to give some updates and discussion regarding that.
Thank you, Madam Chair. Before we start into this, I'm excited about the Black Lives mural in Nashville, Tennessee. We have a great opportunity to share with our friends, families, and colleagues in this city that Black lives indeed do matter. As for the Bordeaux Hospital conversations, I will let you know we, in the Health and Hospital Committee last week, we had a really good conversation in regards to what's happening and where we were, how we got here, and now one of the biggest questions that we're seeking is to find what is the plan for the future. The most important thing right now is the plan for those patients that are there, as well as in their families of what to do, as well as the employees that are there. So those are the people that, as we lead these conversations, that I'm certainly thinking of. So at the moment, in September, our RFQ request was put out for anyone to send in an RFQ request for so they can submit a proposal on the property and on to take over the Bordeaux Hospital and long-term care unit. No one bidded on that proposal, and so now that RFQ time has closed as of September 30th, and we are now set, and I don't know if you all have seen it, the conversation is to wind down the hospital from Signature, who is the operator of the long-term care facility there, is for them to wind down operations to close the doors January 31st. The goal is to have those patients placed in other long-term care facilities throughout the city. And right now, one of the conversations that I would like to have, we've had a lot of one-way conversations from both Signature and the mayor's office, and I would like to bring us all together to help find what those solutions are as we move forward. We're in the middle of a pandemic, and so we know that nursing homes, long-term care facilities aren't necessarily taking new patients. So how are we going to move from there? And then lastly, what is our plan for the patients that are at a disadvantage financially, that can't move or that don't have any funding from Medicare or Medicaid? So that is where we are right now. The goal that I have with this meeting is to, one, host it in the evening, so those families and patient families, those patient families can be in attendance to hear any conversation that we have. And then two, I would like to host it both virtually and in person, social distance wise, so those families, if they can't get there virtually in an equitable manner, they have an opportunity to be there personally as well. So currently right now, we do not have space that I've been able to find that could manage an in-person meeting and a virtual meeting, along with ITS being able to film and record the meeting. And so that's where we are now. I'm working diligently daily now to find space so we can have this meeting as soon as possible. Thank you, Madam Chair. That's all.
And thank you, Councilman Taylor. I know that you've been working extremely hard on this, and I certainly appreciate it. And I know that there are many in the community who appreciate the work that you are doing and putting forth. I just want to say that it has been my suggestion from the very first day that Signature indicated that they were leaving, that Nashville General take over, because once they were over at Bordeaux Hospital, they have ancillary services where they can provide, and it would not cost any more money. In fact, it very well will save money for the city. The employees that are there love working under General Hospital, and they still do have that affinity and would love to work with them again. I am concerned that there are many residents that's been there for 25, 30 years, and they have no other place to go. I also understand that there have been movement of some patients. About 20 patients have moved. The city has in its charter that they should care for Bordeaux Hospital. There has to be a safety net hospital provided for those citizens of Nashville. And I think that the onus should be upon us as a city to make sure that we care for those citizens and the families. And I also know that the beds that they have, they receive funding from the state for those particular beds. So I'm not exactly sure that everything has been disclosed as it relates to this situation. I know that when it first started, there were some things that were supposed to be done by Signature that they never did do. I knew that no one would submit an RFP because it's not a profit-making venture. So no one is going to, sign up to lose money. So as the city has this responsibility, I think that we can still provide. I think that healthcare should be a right and not a privilege. And I think that we as a city should continue to support. Councilmember Gamble.
Thank you, Madam Chair. I totally agree with you that we need to make sure that the residents that are in this long-term facility have continuum in care. And I guess I want to confirm that this is the only, indigent care, low-income, long-term care facility in Nashville, and ask if there has been any discussion about the long-term care going under the Metro General Hospital umbrella.
Councilmember Taylor, you want to respond, or would you like for me to respond?
Councilmember Hurt?
Yes, go ahead.
Thank you. Councilmember Gamble, will you repeat the question again? I want to make sure.
Sure. Yes, it's Councilwoman Gamble again. The question was, has there been any discussion with, seeing that this is the only, to my knowledge, low-income indigent long-term care facility in Nashville, has there been any discussion about moving it under the umbrella of Metro General? And if so, what's the outcome of that?
Thank you, Councilman Gamble. There has been not any formal conversations, I would say. I had a chance to speak with Metro General in regards to their thoughts and their reasoning for not applying for the RFQ, but there hasn't been any formal discussions. I would like this discussion to happen. I have one of the main reasons I did call National General was to let them be aware that this meeting will take place soon. And once we could hit our goals of finding a place that we can have ITS in person, socially distanced, and virtually, that I will let them know immediately, because I do know this question, I'm sure, will come up quite often during this conversation.
And Councilmember Taylor, prior to you taking over health and hospitals, that was my role as chair. And I can say that there were formal conversations held with the CEO of General Hospital and a representative from the mayor's office. I coordinated a couple of calls, meetings that were held, and it was discussed. And I know that the CEO also has been in discussion with the union president, Brian Ransom, and I think that there's been a lot of some saying this and some saying that, so it's been a lot of double talk. So I think it's very important for you to hold the meeting where we can have everyone in the room and it can be clearly stated on all parts where everyone stands. But from my understanding, Nashville General is willing to take over. They needed to assess what needed to be done in order for them to move forward and what it was going to take. They didn't want to just go in without knowing. And that was basically what was being asked, is they be given an opportunity to go in and make an assessment of what needs to be done and then how they could move forward. But I talked with Dr. Webb as late as last week, and he indicated that he would be willing. And that was something that I suggested to the mayor's office, is that, at least allow them to take it over for the next 6 months or the next year while we can develop a long-term plan of what needs to be done. But for us to make the decision in a couple of months, and the parent of the patients, their families and employees only having 2 or 3 months in order to make life-changing plans, I think was inadequate. Councilmember Suara, I think I saw your hand raised.
Thank you, Madam Chair. I think we're all thinking along the same line. Because of the family that are impacted, because of all the emails that we've got, because of the fact that this is indigenous care or indigens, and the fact that there's no other company coming forward, it appears as if we really don't have any solution. And so if the only thing on the table is General Hospital, I raised my hand to be able to ask the question as to whether they were willing and able to do it. And I think in answering CM Gamble, you've already alluded to that they're willing to. So my suggestion will be to CM Taylor that the first place to start will be with General Hospital, and to continue that conversation and get a commitment from them and what they would need to be able to do that. I think we as a body can say, let's look into this option. There's no other option. And so just meeting and talking about we need to find a solution, we just take more time. These are people's lives that are being impacted. If General has already indicated they're going to do it, and we know that they can do it, why can't we not suggest them, CM Ord said, as 6 months, let's see where it is, to give the family time to make sure that we're not putting people out until we find a permanent solution. While we can then have all this discussion that we need to have, I'm okay with having discussion, but time is of the essence. People don't know what to do. People don't know what to do with their loved ones. And so there is a part here. And I think what I would recommend is let's see that through. What does that look like? What does General need to be able to access? What does the cost look like? What are we talking about? That's what I would say. If you want to go ahead and pursue that, and if we need to put our mouth in there as a caucus to say we need to see this through as an option, unless somebody else have any other solution, which I'm not hearing. And so I think let's do that. 6 months, and then we can start talking about what else we need to do after that. That would be my recommendation for the sake of the people that are in there and for the sake of the families that are impacted.
Thank you, Councilmember Suara. Is that a motion that you are making?
Yes, ma'am. I will move it as a motion.
Thank you. Is there a second?
I second.
Thank you. Is there any need for continuous discussion in regards to the matter? And I think that you're absolutely right, Councilmember Suara and Councilmember Taylor. This is something that we've been discussing for months. And as she said, time is continuously passing us by. And we know that come November, we're going to be getting in the holiday season and everything slows down during that time. So, and I'm really concerned about those residents and the employees. So I thank you for that. I would like to move forward with taking a vote, a roll call vote. So, yes.
After this roll call vote, can we have more discussion in regards to COVID funds as well?
Absolutely, absolutely. So, Councilmember Suara.
Aye.
Councilmember Toombs. Councilmember Toombs. Councilmember Gamble.
Aye.
Councilmember Taylor.
Aye.
Councilmember Sepulveda.
Aye.
Councilmember Porterfield.
Aye.
Councilmember Stiles.
Aye.
Councilmember Lee.
Aye.
And there is aye for Councilmember Hurt. We will also submit a statement. And I think that this letter or a statement should go directly to the mayor's office, just as we would have with Black Lives Matters mural. Thank you so very much. Councilmember Taylor, I will lend you the floor for you to make any comments or ask any questions in regards to COVID-19.
Thank you so much. So during this this wind down process or turnover or whatever we're going to be doing with Bordeaux Hospital, I do know that there is opportunity there, and I want to speak or ask some questions for Councilmember Gamble, or Councilmember Gamble or Councilmember Sepulveda, being members of the COVID-19 funds or CARES Act funds. Is there any possibility if we found a replacement operator to take over the long-term care facility at Bordeaux, for them to receive COVID-19 funds to serve those patients?
Just Councilwoman Gamble, and I can respond first. I think so. I think that if there's an operator such as Metro General would want to submit a proposal of how much, what would be needed to support the hospital or the long-term care during this COVID-19, I'm sure there are many needs related to the health crisis that we're in that could be supported by the COVID-19 funding. That funding has to be used by or administered by December 30th. And if there was a proposal or a a reason for those funds to be used to support the long-term facility during as it relates to COVID-19 up until that point, then yes, I think it would be very prudent for the operator to submit a proposal to the committee for that.
This is Councilwoman Sepulveda. I did speak to someone earlier when they asked about the CARES Act funding being used for this purpose. I did note that the committee did just vote this Thursday to set aside $20 million. Of course, that's not binding. I told them if they were to submit a proposal to us to see how much it would cost, that the committee could certainly look at that. I don't want to speak for the whole committee. I don't know where a lot of them would land, but I certainly would be open to, hearing what is proposed, and it sounds like Councilwoman Gamble would as well. They did make a good point that these are people who are going to be losing jobs, and there are patients who are going to be, displaced and need a move, and so there is quite a bit involved with this whole situation. So I would suggest that they get a proposal to the committee as quickly as possible, since we do have many departments who are still waiting on funding and who had asked for funding, and we're coming towards the end of our deadline, and unless that gets extended.
Thank you both. And I think that would be very appropriate, considering that this is a vulnerable population, the most vulnerable population of people, considering that many of them are aged as well as having pre-existing conditions that is at risk with COVID-19. And, once it gets inside, it is a vicious virus that goes forward. So I think that would be very appropriate to make sure that it is a safe environment and to keep them safe from any possibility of the virus coming in and spreading amongst those patients. So, Councilwoman Suara, I see your hand. Is this from previous time? Or do you have a question?
Yes, ma'am. It's from previous time. Sorry about that.
That's okay. Thank you very much. Councilmember Taylor.
Thank you, Councilmember Sepulveda and Councilmember Gamble. I will definitely, I'll keep you guys in mind as we move through this. Councilmember Hurt, thank you so much for the institutional knowledge that you have just for the history of this conversation. As we move forward to scheduling a meeting, again, right now it's not looking great for us to have an in-person meeting. It may have to be virtually done. But as we move closer to finding a date, I'll definitely let the caucus know. I would be honored to have you all there. And there's some questions, the questions that you have, and if you don't have any questions as of now, please think of questions to ask, because we really want to protect these patients and their families, because there's families and patients that have been there for many, many years, and there's patients that may not have the opportunity to find another space, and which is most important. And so we want to make, if there is going to be a transition of any kind, if they're going to stay where they are, the patients stay where they are, and it's a new operator that transitions in, or the patients do end up transitioning out of the building, we want to make it seamless, and we want it to be inclusionary with the families to help them make those decisions. And so, again, I'll get that information out. I've been working very closely with the council office and vice mayor and mayor's office, as well as Signature, to get a date that everyone's available, and to make sure that everyone is prepared to share with the council body, as well as the community. I've invited both personnel and Budget and Finance as well to have this conversation, Budget and Finance, because this definitely deals with our fiscal responsibility as a city, as well as personnel, because there's been a lot of conversations in regard to Metro General, Nashville General Hospital, assuming that role. And so personnel will be important to have in this conversation as well. Thank you so much for indulging me, Madam Chair. That's all I have.
Thank you very much, Councilman Taylor, for your leadership. We certainly appreciate it, and we stand here ready and willing to support you as we move forward. So I will communicate these things to Rosie, and we'll get a statement out in the next couple of days, hopefully. And if there are no other questions, any comments? Then I will say that this meeting is adjourned. Thank you all very much for attending. Thank
This has been a service of the Metro Nashville Network. If you would like to see this presentation again, or for more information about this and other programs, visit nashville.gov.